Hi. My name is Nichelle. Um, I'm going to be 52 in 2 weeks. Hey, Ellen, come here. I've been married for 31 years. I have two beautiful daughters, Emma and Anna. And 2 weeks ago, I was diagnosed with squamous cell carcinoma anal cancer. I didn't even know there was such a thing. I was always one of those people that always said that I would never get a colonoscopy because I didn't want somebody touching my butt because it was embarrassing. But about 2 months ago, I had started having issues. A lot of rectal bleeding in the toilet, as if I was on my period, but I had had a hysterectomy a ways back, so that was weird. I didn't have any pain. I had pressure down there, like I had to go to the bathroom, but then nothing would come out. Blood clots, mucousy blood, a lot of diarrhea, and my stool was narrow. And my husband had just had a colonoscopy for the first time, and so I'm like, okay, I'll go. And so I went to my primary provider and told her the symptoms I had been having. And she had mentioned hemorrhoids. And so I'm like, I probably just have hemorrhoids, but I thought it would be weird that hemorrhoids would bleed that much. And so I went in for my colonoscopy, and right when I came out of anesthesia, my husband was sitting there, and the doctor came in and said that he had found something that looked malignant. And so then 2 days later, I had it was a tumor. It was a 2.8 centimeter tumor. I had it surgically removed. And when I came out of anesthesia at that time, my husband was sitting there again, and the surgeon came in and said that in his opinion, it looked cancerous. So at that point, unofficially, we knew we were dealing with something. And then about 3 days later, it populated in my chart, and I expected it to be carcinoma or adenocarcinoma of the rectum. I had been watching a lot of YouTube videos, searching for information, and that was what came up. And so I expected it to be adenocarcinoma of the rectum, but that's not what it was. And I was totally shocked. It was squamous cell carcinoma anal cancer phase 1. So they caught it early. So thank goodness I had been paying attention and listening to my body, and recognized that things were not normal. But it turns out that it was caused by me testing positive for the HPV 16/18 virus. That was not what I was expecting. So it made me think, thank goodness, I had gotten my girls vaccinated for HPV when they were 13. I remember when it first came out, I think they were like around 12, and it was kind of controversial. So now I'm really thankful I had done that. So this week, I met with my oncologist. Yesterday, I met with the radiologist oncologist, and today I went in and did my mapping for treatment. I'm going to have 6 weeks of the chemo pill, and I'm not gonna have to have a port. They're gonna do a one-time infusion, like in my vein, in my arm, and then along with the pill, every day for 5 days for 6 weeks, I'm gonna have radiation. The pill and the radiation go hand in hand. And that is probably going to start in 2 weeks. Yeah, for my 52nd birthday. How interesting. So I just thought I would come on here. I never thought I would be making a YouTube channel for this. I enjoy watching YouTube sometimes, but I'm very much an introvert. So this was hard for me to do. But when I was researching, looking for people's stories on YouTube to find out more about squamous cell carcinoma of the anus, there wasn't a lot out there. Most of the videos I found were the adenocarcinoma, colorectal cancer. It turns out squamous cell carcinoma, anal cancer, is very rare. And it's just weird to think that you could have skin cancer in your butt. So that's why I thought I would come on here and make a video, introduce myself. I just thought I would make videos for people who, like me, didn't know anything about it and like wanted to know more. So I just thought I would document my story. Maybe make one video a week, as I go through treatment, and just tell you about the treatment and the side effects, and like if anybody finds my videos, you can ask me questions and I'll answer you to the best of my ability, based on my experiences, what I'm going to go through. Maybe it can enlighten people and help people. So hi. I guess that's it. I hope you're all doing well, and I will see you again. Bye.